Okay, so Sean, we're gonna do a physical assessment, and there's a couple of things that we've already done before you came in here. We've already, had you empty your bladder, we've got you undressed enough where we can do the exam, got your vitals, we got your height and your weight, and we also did the Snellen eye chart, out in the waiting room, so, those parts and those things are already done. So, I'm just gonna start at the top and we'll just work all the way down. And then I'll ask you obviously to do a few things, and so you just follow the instructions, okay?
Mm-hmm.
So the first thing that we're gonna assess is gonna be your head and your face. And I'm just gonna inspect and just kind of generally, look at you. Your eyes are set symmetrically, your nose is midline, your lips are, look the same, and they're symmetrical on both sides. And if I pull your hair back, your ears are even set and symmetrical. So then I will palpate your head and your scalp, and I'm just feeling for any abnormalities, lumps, bumps, bruises, which I can't really see bruises, but you would tell me if something hurt. And then I'm gonna hold your head up, I'm gonna palpate your face, your facial bones, just to make sure that there's nothing that's unstable, no pain or anything like that. Okay, I'm also gonna go ahead and just palpate your sinuses. Don't really have any pain or anything like that. Okay. So go ahead and close your eyes, and I'm gonna palpate what's called the lacrimal apparatus, just no pain or anything up in there.
No.
None across the bottom or anything like that.
No.
Okay. All right. So we'll check your cranial nerves. What I want you to do is smile real big for me. Show me your teeth. Good. Squinch up your eyebrows. Raise your forehead. Wrinkle your forehead for me. There you go. There you go. Close your eyes tight for me. Good. Okay. Puff your cheeks out. Good. And then I want you to shrug your shoulders. Shrug. Very good. I think. Did I have you show me your teeth and smile?
Mm-hmm.
Okay. Good. All right. So everything as far as that, as far as those cranial nerves, they are intact. And I'm going to go ahead and look at your eyes and do your eye exam. So the next thing with eyes are, again, I'm just looking, your eyes are equally symmetrical, set. Close your eyes for me. I'm looking at your eyelids. Those are, there's nothing abnormal about your eyelids. You can open. Your eyelashes curl up and out. Your eyebrows, are symmetrical. So that all looks good. A couple of things here. There we go. So what I'm gonna have you do is, I'm gonna just I'll have you look right straight over my shoulder, and I'm just gonna do a pupillary response here to see. So there's gonna be direct, and I'm looking for consensual, good. Same thing on this side, direct, good, and consensual. So I'm gonna look what's called for a red reflex, okay? So my right eye to your right eye. Just kind of look straight at me. I do have to get kind of close to you, so. Good, okay. I'll come over and look on this side. Good, great, okay. The next thing I'm going to do is I'm going to actually look at your sclera and your conjunctiva, and for that I'm just looking to see, is it nice and pink or is it pale? And so your conjunctiva on both sides, and that would show indicative signs of anemia or something like that. I want you to look up. I'm looking at your sclera now. Look up and to the right. That looks good. Look up and to the left. Good too. Same thing with this eye, up into whatever, right? Okay. Good. And the other side? Perfect. Okay. I want you to just pick a point right straight over my shoulder. Now look at my finger. Good.
Oh.
That's okay.
Okay.
That's what I want you to do. Look right straight over my shoulder, look at my finger. Good. And that's a convergence type, and there's a reflex with that, it's fine. So cover one eye for me. Okay. Take it down. Good. And so there's a pupillary response, and your eye does not move, which if it did, that would be abnormal. Cover the other eye. Okay, look straight ahead. Bring your hand down. Good, okay, that's perfect, perfectly normal. Let's see. Going on, I have to think about eyes. So going on, we'll move to your ears. Let me take all my stuff. And again, yeah, pull your hair back. So what I'm just looking for is I'm just inspecting, and everything on the outside, you know, looks normal. Like from this side, the pin and the auricle all look good. But I'm gonna look at the back, just because I just wanna see, make sure you don't have anything, you know, any skin lesions or anything like that in the back of your ears. Am I done? See anything? So then I'm gonna actually take a look in your ear. And your canal looks good. Your tympanic membrane is nice and pearly gray. I don't see any bubbling or anything. A little bit airways. And this one, same thing. The canal looks good, and your TM looks nice and pearly gray. Good. And there's not any pain or anything if I palpate or pull on or anything like that?
No.
Good. So then, one of the things I did not get is okay. So as far as for hearing, I'm gonna test a couple of things. One of the first tests is called a Weber test. I'll hit the tuning fork and then I'll put it on the top of your head. I want you to tell me if you, when you hear the sounds, does it sound the same on both sides? Okay, so that's what we're looking for.
Yes.
Okay, both sides?
Mm-hmm.
So then the next one is the Rene test, or some people pronounce it Rennie. So what, I'll hit it, and then I'll put it to your mastoid bone. You'll tell me when you stop hearing the noise.
Okay.
And then after that, I'll bring it down in front of your ear,
Okay.
and you'll tell me when you stop hearing it.
Okay.
Okay?
Mm-hmm. I stop.
Okay, tell me again when you stop hearing it.
Stop.
Okay. Let's do the other side.
Stop. Stop.
Okay. And that's appropriate because bone conduction is shorter than air conduction, so you would hear it, you know, longer when you're just listening to it. The next ear test I'm gonna do is, I want you to cover your left ear, and I'm just gonna whisper a word. I want you to tell me what you hear, okay?
Banana.
Good. Cover the other end, good. I'll come over here.
Football.
Okay, good. Hearing is intact.
Sometimes.
Okay, so then next I wanna move on to your nose. And then what I'm just looking for again is symmetry. I don't see any trauma. It doesn't look swollen or anything like that. So I'm just gonna take a peek. If you put your head back a little bit, I'm just gonna look right up in there. And your turbinates look fine. Your septum looks like it's all intact. I don't see any exudate or any drainage on that side. Move over in here. And I don't really see anything abnormal on that side. I'm gonna shine this light this way, and I'm gonna kinda look to see if I see any light on the other side that would show a tear or anything like that in your septum, and I don't see anything that way. I don't see anything that way. Okay. So then the last thing I need for you to do is then just occlude one side. Taking up, just breathe in. Good, that's patent. Do the opposite. Good. Okay, that's patent too. That's okay. We'll move on to your mouth and to your oral mucosa. So I'm gonna let you open your mouth for me. Okay. And I'm just gonna kind of look at your gums. I'm gonna look up at your hard palate. All the way around. And look. Okay. Bottom. I don't see, I'm just looking for any kind of lesions or bleeding or anything like that. Your teeth are all intact. I don't see any cavities or any missing teeth or anything like that. Good. I want you to stick your tongue out for me. Oh, and that was one of the things I forgot for you to do earlier with cranial nerves. Stick your tongue out. I want you to move it side to side. There you go. Good. Okay. So now we did it. I forgot that cranial nerve. Okay, stick your tongue back out for me. Good. And I'm just gonna take a look. Lift your tongue up. Hang on, it's got a little thing on there. Sorry. Okay. Lift your tongue up for me. Good. I don't see any lesions or anything under your tongue. Cranial is intact. Okay. Now, I am going to probably make you gag a little bit, and I totally don't mean to, but, say ah. Good. You don't have a gag reflex. Good, okay. So, as I'm looking inside there, there's no, I mean, your uvula is completely midline, your tonsils are like a 1+, which is normal. So I don't see anything abnormal or anything inside your mouth, which is a good thing. So next, I'm gonna move on to your neck, and I'm gonna just kind of inspect and look, and I don't really see anything abnormal. I'm just gonna make sure, I'm gonna palpate, make sure your trachea is midline, which it is. Good. I'm gonna palpate your nodes, so this is your occipital nodes, postauricular, preauricular, I don't feel anything, submandibular, tonsillar, submentum, I don't feel anything, which I'm not supposed to. I'm gonna palpate your anterior, cervical nodes and posterior as well, and I'm not feeling anything. Go ahead and put your hands on your hips for me. Bring your shoulders forward, okay, and I'm gonna palpate for any supraclavicular nodes, and I don't feel any of those. Bring your arms straight out, and I'm gonna palpate your axilla. And I don't feel any nodes there as well. So I want you just to look straight ahead. I'm gonna palpate your thyroid. And I'm gonna, to do that, I'm gonna kind of scoot your muscle out of the way there just a little bit. Now I want you to just swallow for me. Okay? Do it one more time. Okay, good, and I can see it, it doesn't, you know, when I palpate, it doesn't feel any different, I don't feel any masses or anything like that. I'm gonna feel your carotid pulse here on either side. Okay. And I'm gonna listen for any bruits in both your carotid and your thyroid. Hold your breath for me. Okay, breathe. Okay, good. So then I'm gonna move to your upper extremities. We did the shoulder shrug earlier. Go ahead and put your arms out for me. I'm gonna push down, don't let me. Good. I'm gonna push up, don't let me. Good, it's nice and strong. You can relax your arms down. I'm just gonna feel your radial pulse here. I'm gonna feel your brachial pulse. On both sides. Okay. I'm gonna check your brachial reflex here. Just relax your arm. Okay. Actually, hold that up there just a little bit. Good. Good. I'm gonna do the same thing on this side. Good. Okay. I'm gonna move on to your chest. What I actually would like for you to do is to swing your legs around this way. The first thing I'm gonna do is I'm just gonna inspect, just visualize your back, everything, your scapula looks symmetrical, your spine, everything looks like it's in line. Go ahead and take a nice big deep breath for me. Okay, good, let out. And all of that as far as my hand movements appear to be symmetrical whenever I'm looking at that.
Okay.
So then the next thing I'm gonna do is I am going to, I'm gonna listen to your back just because I'm here. Nice big deep breaths in and out. Exit silent. one more time over here. Good. I want you to say the words, I want you to say 99 for me.
99. Again, 99.
Again.
99.
Okay, good. Tactile fronitus is what we just tested for that for. Now the next thing I'm gonna do is test for what's called diaphragmatic excursion. It just sees, you know, what the difference is in your diaphragm when you inhale and versus exhale.
Okay.
So I'm gonna have to percuss, and when I do that, you're gonna take in a big deep breath and hold it for
Okay.
me, okay? And then I'm gonna mark on your back here just a little bit.
Okay.
Okay, whenever you're ready, take a big deep breath in and hold it. Okay, breathe, good. Okay, so then the next thing I want you to do is take in a big deep breath, let it out, and
Okay.
hold it,
Okay.
whenever you're ready. Okay, stop right there. So I have a little bit of, I got marker on your shirt, I'm sorry, but there's a little bit of a difference, and it's within 3 to 4 millimeters, and that's the difference on this side.
Okay.
I'll do the same thing with this side.
Okay.
Whenever you're ready, take in a big deep breath and hold it. Oh, okay, right there, breathe. Okay, whenever you're ready, take that big deep breath and let it out. There it is, okay, good. So you can always measure and see, your right side's gonna be, should be a little bit, lower than your left, that's good. You can swing your legs back around here. I'm gonna look at you from the front, you know, just to do, just to inspect and watch your respirations. Your breathing does not look labored, it does not look like, you know, you're having any difficulty or anything like that, nice and even. I'm gonna palpate your chest, you know, just to see if you have any bony, any crepitus or anything that, you know, feels strange. Raise your arms up for me just a little bit. Don't, I'm being relaxed, I'm just gonna kinda feel your precordium there. I can feel. Now I'm also gonna feel up here for their point of maximal impulse, sorry. And I can feel that, okay? So then I'm gonna take a listen here. Big deep breaths again. Okay, raise your arms up. Okay, this side. Good. Once more. Okay. I'm gonna listen to, I'm gonna listen to your aortic valve. Listen to your pulmonic valve. I don't hear anything abnormal, which is good. I'm gonna listen to Erb's point. Okay, listen to your tricuspid valve. And I'll listen to your mitral valve. Okay. And I'm also gonna percuss a little in the front just to make sure it all sounds the same. Okay, raise your arms up for me. So now I'm gonna move on. Everything seemed normal and good. I'm gonna move on to the abdomen. So what I'll have you do is go ahead and just lay back. Put your feet right out there. Again, all I'm doing here is just inspecting. I'm looking for any pulsations I might see, any asymmetry. I don't see any surgical scars. I don't see anything that looks abnormal. So then the next thing I'll do is auscultate instead of palpate first. And we're gonna palpate for a full 2 minutes, which is in the assessment, which for all quadrants. Okay, then the other thing I'm gonna listen to are some different arteries here, so like your aortic. I'm just listening to see if there's any abnormalities, like when you listen to the aortic artery. You're listening over here to both of to the renal arteries. And then to the iliac arteries. And then again to the femoral arteries. And I don't hear anything abnormal with any of those. So then we'll just do some light palpation here first. Just let me know if you have any pain if I push.
No.
No pain?
No.
Okay. So it's gonna get just a little bit deeper here, seeing if I can feel any of your internal organs here. Push. Any pain with any of this pushing?
No.
And here?
No.
And here?
No.
I'm gonna just kind of percuss here a little bit. Okay. One of the things I do want to do is see if I can't find your border of your liver here. Take a big deep breath in for me. Okay, blow it out. Can't feel your gallbladder, I'm trying to, but that's not an abnormal thing. So one of the things I am gonna do here is I'm gonna start up here at the top, and I'm gonna see if I can't, find the borders of your liver, okay?
Yep.
Okay, so here is the distance that I could use our ruler, and the distance we could say would be, you know, how far apart or how large your liver would be right there. The other thing I'll have you do is, actually, I'm gonna see if I can't palpate part of your spine. That's pretty hard to palpate. See if I can't find the kidney right there. It's pretty hard to find. See if I can palpate over on this side. Come up on your right side. And look, don't fall off the. And what I'm gonna have you do is bring this arm kind of up that way. And I'm gonna percuss for dullness, which would be splenic dullness over here on this side, okay? Oops, it's okay. So right about this area right here is the dullness that I could percuss for for your splenic area, okay?
Mhm.
So I'll let you roll on that. Nope, you don't have to do that.
Oh, I
Roll on
okay.
back, yeah. Okay, now I'm gonna put this down and you can sit back up actually. So then we're gonna do your lower extremities.
Okay.
And again, all I'm doing is just looking at your extremities.
Mhm.
And I don't see anything abnormal, I don't see any varicosities, I don't see any swelling or anything like that. So I'm going to feel for dorsalis pedis and posterior tibial and popliteal pulses, and those are all good. Again, this side as well, dorsalis pedis, posterior tibial, popliteal. Good. Push down, push, there you go. And then I'm gonna pull, nice and strong, good. I'll let you go ahead and stand up here for just a minute.
Okay.
I want you to look at me, we'll do some cervical range of motion here. Put your chin to your chest and up, good, looks side to side, ear to shoulder, good. Turn side to side again, but against my hand, good. And against my hand there, good. Turn around for me, I'm gonna take a look at your back and your lumbar spine, bend over. And what I'm looking for here is just to see that your spine is nice and straight, and it is. Good, thank you. I'll let you go ahead and lay back down on the bed there. We'll kick your feet up. I'm gonna check your lumbar spine, and by doing a couple of things, there you go. I'm gonna raise your leg up. Any pain with that?
No.
Good. Raise this leg up. Any pain with that?
No.
Good. I'm gonna take this leg, we're gonna bend the knee, put this there, and I'm just gonna kind of lightly apply some pressure. Any pain in your low back with that?
No.
Okay. Let's do this. I bend your knee, ankle up, there you go, and I'm just gonna lightly push. Good, any pain?
No.
All right. Now I'm gonna let you turn onto your stomach. Don't fall off. Okay, one last thing here. I'm gonna have you bend your knee up here, and then I'm gonna raise your leg. Any pain in your low back with that movement?
No.
Okay. Next one. Raise this up. Any pain with that movement?
No.
Okay. You can be careful, come on back. You can sit back up. That's actually the end of the assessment. There are a couple of other cranial nerves that you can check for. And that would be olfactory, which, would smell and taste, which we don't really typically do any of that. And so then I think one of the other things that I do want to check in your back though is some CVA tenderness, with your kidneys. So what I'm gonna do is I'm gonna put a little pressure here, and I'm gonna just kind of give it a tap here. Any pain with that?
No.
How about over here on this side?
No.
No? Okay. And then a couple of other things that I am remembering I didn't do with your extremities, are your reflexes. I'm gonna check your patellar reflex.
I'm sorry.
Okay, that's all right. All right, and then I'm also gonna check your Achilles reflex. I'm gonna kind of hold that there.
My reflexes are like
It's okay. That's
off the
all right.
chart.
Okay, okay. All right. Is there any questions that you have for me or anything that?
No.
We can, all right. Well, I appreciate your time. Thank you
Thank you.
so much.
Thank you very much.